Whether you are a chiropractor, dentist, veterinarian, or other specialty healthcare provider, you know that this is the lifeblood of any practice. Of course, we're talking about new patients. As a healthcare provider, we're in the business of helping others. With that said, we are still a business. And as with any other business, there are many expenses involved in keeping our doors open. Just like any other business, we need to remain profitable in order to continue to help people and provide our specialized services. It doesn't matter if you're an optometrist, audiologist, or cosmetic surgeon. We are all in the same boat together. If you are a healthcare provider, then you know that patient bad debt is becoming a serious threat to profitability. It is estimated that $65 billion in revenues went uncollected in 2010. On average, a staggering 50% of every dollar billed to patients goes uncollected, even after sending as many as 3 billing statements. And that is why I am so excited to tell you about the service that Patient Payment Solutions has to offer, and I know you'll be excited too. The best part is that our simple, cost-effective system will make your care affordable for virtually every patient that walks in your office. As you already know, the world of healthcare reimbursement is constantly changing. The days of insurance covering all of the services that we bill are gone. It seems as though every day that passes, it becomes more challenging to receive reimbursement from insurance companies. With declining insurance coverage, patients now account for 30% or more of a provider's revenue stream, and about 60% of your patients will require monthly payments to be able to afford treatment. Making healthcare affordable is obviously a major topic being discussed by patients, providers, and even in Washington. The Affordable Health Care Act, or Obamacare, has become a hotly debated topic by all. I think we all can agree that changes are definitely needed, and whether you support Obamacare or not, there is tremendous uncertainty in the future of healthcare. The trend has been set and the writing is on the wall. Patients will be facing higher out-of-pocket costs for treatments, and the number of procedures covered by insurance will likely continue to decline. Just imagine all the potential patients unable to receive the treatments that they want and need. What I'm telling you is not new to you, and most of you have already attempted to make accommodations. Perhaps you accept CareCredit or other medical credit cards. Let me ask you this: how many patients are you turning away every single day who don't qualify for medical credit cards? And how many patients are unwilling to even apply for a medical credit card because they know they won't get approved? I've even had patients in the past who are earning more than $100,000 per year who do not qualify for CareCredit because of a small dent on their credit score. Okay, I know what you're probably saying to yourself. What alternatives do I have, right? Perhaps you've offered in-house financing and tried statement billing in the past. We all know how futile it can be to collect money owed to us at times. We're rich doctors, didn't you know? Let's face it, as a healthcare provider, you are often at the bottom of the priority list when it comes to paying bills. What if I said I have a solution that will increase your cash flow, reduce patient bad debt, accelerate patient payments, and lower your medical billing expenses? Would that get you excited? What if I told you that you could make your treatment affordable for virtually every person who walks in your door and offered you the ability to have 100% case acceptance? What if we could do all that with no credit check? Yeah, you heard me, no credit check. What if you were able to see just one more new patient each week because of this program? What would that do for your revenues? Do you think that would make you more profitable? The answer is absolutely. What if you could have a recurring revenue stream that could potentially cover all your fixed expenses? Think about what would happen to your stress levels if you knew ahead of time that you had an extra $20,000, $30,000 or more coming in each and every single month. All of which is deposited directly into your account, which means no more waiting for weeks or months for checks to arrive in the mail. So I probably have not told you anything that you didn't already know. These are all problems that we all have to deal with as healthcare providers. But I want you to know that I think Patient Payment Solutions has come up with a solution to a lot of your problems. Patient Payment Solutions was started by doctors and billing specialists who know the challenges of running a successful practice. Our auto finance terminal was designed out of necessity. It was designed to meet the specific needs of providers and provide the solutions to a challenging and constantly evolving healthcare environment. Our streamlined and user-friendly platform allows healthcare providers to replace or complement any other credit program currently used in your office. Now, I'm not going to go into a long-winded explanation about all of the details. However, I would like to highlight some of the most important features. Number one, our auto finance terminal is extremely easy to use. and we provide unlimited free training as well as have a series of training videos to get you and your staff familiar with the system. Number 2, there is a 100% patient approval. That allows you to accept any patient that walks in your door. Number 3, no credit check, which means you're not scaring away patients who don't want another credit card. Number 4, you set the terms. Flexible recurring payment plans allow you to tailor fit the plan to your patient's needs. Number 5, we do all the follow-up and account management. Why not let a third party handle your accounts receivable for you? Here's some more reasons to use patient payment solutions for your patient financing needs. Make your care more affordable. You can increase your case acceptance percentage. By making payments automated, you move to the top of the payment list rather than the bottom. Stabilize your monthly income even during slower times of the year. You collect more money. You will decrease your billing expenses. You can increase your referrals from satisfied patients. By outsourcing your accounts receivable, you will spend more time doing the things you enjoy doing, like treating patients. There is no expensive software to purchase, download, or upgrade. Our web-based auto finance terminal is accessible through any computer with internet access. Your patient data is safe and secure, and we are both PCI and HIPAA compliant. Our convenient reporting tools allow for accurate predictions of monthly revenue and allow you to plan for the future. So how much does this all cost? The answer is practically nothing. The cost of the program can be negligible simply by transferring our lower transaction expense to the patient payment plan. This is usual and customary in all business types and is expected by patients. So stop. Stop losing patients today. There are no long-term contracts to sign and cancel anytime. You have nothing to lose except new patients. Call an account representative today at 1-800-501-3897 to set up your account.